Hey, everybody. My name is Dr. Lenny Roberts, and it's a pleasure to be here with you virtually and not live. But I wanted to share with you my experience of what it is to be a chiropractor and what chiropractors do and who they work with and how they work with it. So I'm going to share with you actually a presentation that I did for the graduate kinesiology program for Temple. Good friends with an athletic trainer who's also a teacher there. And I think that this will have some crossover and some relative, give you an idea of what we do and what chiropractic is all about. So a little bit about me. Dr. Lenny Roberts, born and raised in Roxborough, worked with the 76ers for 6 years, one of the team chiropractors. And that was during the process. So I don't think too many of you were in the stands there. So if you say you trust the process, I'm not sure if I believe you. But that was an interesting experience. Some of the worst team sports records in the history of all sports, but suffered through that. And then since 2015, I've had the pleasure of working with the Temple University football team as a team chiropractor there. Founded Summit Spinal Wellness, which is located in the Roxborough section of Philadelphia. And our mission is to empower families towards their full expression of life. So you may or may not be familiar with who this guy is. For those of you that aren't aware, that's Bradley Cooper. And Brad and I actually went to high school together. And here's a quote that came out. I apologize if you can hear my kids in the background, but we're doing the virtual stuff and making the most of it. So, but this is Bradley Cooper talking about what his role was in Silver Linings Playbook. And if you look down here, he said Lenny Roberts was a guy in high school that dressed like the way we decided Pat, the character that he played, would dress. And that wasn't all that flattering. But Brad and I did go to high school together and hung out and drank some bad beer together. But we'll leave that as it was. But a little bit more about me and what we do. This is a picture of a bridge in ancient Greece. And this bridge is over 3,500 years old. The reason why I wanted to start with this picture is because this picture closely resembles what you see here with the bridge going over the Manioc Canal, Main Street, Manioc, where that arch configuration. This bridge is still in existence. People can still walk over it, under it, and obviously this one is as well. And the reason why is because the weight of this bridge is dissipated over that entire arch. And it's an engineering premise, but that arch gives that bridge substantial support and stability. And this is not just designed to look pretty, but also to give that bridge support and stability located in Manioc. The reason why I talk about that is how most of you are probably sitting right now. You're maybe slouching forward at your desk, at your laptop, on your phone, however you might be watching this. But our posture is critical. Posture affects and moderates every single physiologic function from breathing, nervous system function. It affects everything we do and everything we think and how everything all comes together. So here's a representation of what normal would look like. So straight on, we should have a straight line from the center of our spine straight down through the center of our pelvis. Our shoulders and hips should be even, so we shouldn't have any tipping or shifting away from the midline. From the side, take that arch-shaped configuration of the bridge and put it on its side. We should have a curve in our neck and our lower back facing the same way, opposite direction in the mid-back. That would be normal. So this is a representation of an x-ray on the left of what a normal healthy spine would look like. So on the left here, you have the jaw, the skull. You want to see that nice, beautiful arch-shaped forward-facing curve. The bone should be square. The space in between is where the disc sits. That should be nice and even and open from front to back. Now, typically after trauma, and this can be accidents, falls, sports injuries, but the most common thing we see is looking down at the phone, the computer. The head shifts forward and your spine starts to flatten out. And if you look down at the phone once for 10 seconds, no big deal. If you do it over and over and over again, in your generation, those of you sitting here watching this presentation, the newest research shows that over 350 times per day you check your phone. So that is a substantial amount of loading and pressure and tension, and it's going to break your spine down prematurely. And if you look in through here, this is all, these bones and discs are all the same age, but these here are breaking down prematurely because there's an abnormal stress and tension being placed upon them. So I think even just the skin of my hand with that curve, everything's nice and relaxed. If I flatten that out, pressure and tension builds up. And it's the same concept going on right there in the x-ray. So think of all the muscles that attach to your spine. Normal, nice arch-shaped curve, everything's nice and relaxed. This is what happens when the head shifts forward. So many of you might be having a lot of chronic tightness and discomfort and pain up in this area here, if you take a couple fingers and dig in there, betting that that's a tight, restricted, uncomfortable area and you carry a lot of stress there, well, take a look at your posture. And that may be a reason as to why. So here's a representation of two different pelvises. So this is, or the hips. So here's the top of the hips, and you can see this is nice and well balanced. And if we bring a line straight through the center here, the spine's lining up with that. Here is a representation of a hip that is shifted, and the hip on this side is much lower than on this side. And instead of the spine lining up nice and straight through here, it's shifted over to the side of the low hip. Now that imbalance may not lead to any symptoms, but every step this person takes is going to perpetuate more and more and more imbalance over the course of their life. So think of like hitting a pothole driving a car. You can still drive the car. You don't have to get the engine replaced or trade your car in because you hit a pothole. But if you don't realign the tires over time, those tires are going to break down and wear down abnormally. The same thing happens with the spine and the body. Big picture, the spine houses our nervous system, which again controls every single function in our body, how you breathe, move, digest, play any type of sport, how you wake up in the middle of the night, you go to the bathroom. Everything's controlled by our brain, sending messages through our spine, out through our nerves, to every single cell, tissue, and organ in the body. So what we look for, again, is that optimal structure or that optimal curve. And if somebody comes into our office, say in this area here, where they started to lose their curve but haven't had substantial breakdown, we can typically get that back real close to normal and bring that all the way back. But if somebody continues to break down over time and they don't get this dealt with and don't rebalance it, this is why the vast majority of society shrinks as they age. Losing fluid content in these discs, and these discs break down and you lose height and you have a whole lot more stress and tension on your entire spine and nervous system. So the reason why that happens is called Wolff's Law. So I'm not sure where you are in school as you watch this. I know your intro to Kines, but if you haven't had an anatomy and physiology, Wolff's Law states that bone remodels in accordance to the stresses placed upon it. And Davis's law says that soft tissue does the same thing. So going back to the analogy of this from a muscle standpoint, the soft tissue, muscles, ligaments, and tendons, normal with a curve here, constantly under stress, constantly under tension here. These muscles are going to be more prone to injury, more susceptible to not functioning properly, more susceptible to pain than these. Same concept. These joints and discs are more healthy here when you have more of a curve configuration than if you don't. You start to shift the loading of the joints forward and down, and they start to break these joints and discs down more so than these. So think of having a bowling ball right here at your side versus holding it out in front of you. See, the bowling ball is 12 pounds. It's about the same weight as the average human head. So if we have our ear over our shoulder with a curve in our neck, that's where we're supposed to be. Each inch that head comes forward adds another relative stress and tension of 10 pounds additional stress and tension to the entire spine and nervous system. So having this, again, the most common posture that we see is that head shifts forward, shoulders internally rotate. It's called upper cross syndrome up and through here, and how all the muscles are affected. That is a huge contributor to low back pain because so much of our society is seated for a living, and especially now with these Zoom calls and virtual learning and those sorts of things. We're spending a ton of time sitting, which is rough on our body as it is. Most of us are sitting with really lousy posture on top of it. So we try to find what we call a subluxation. Sub is less, lux is light. So subluxation is like a dimmer switch on your body where you've lost proper structure or proper function. And the bones in your spine, they should move when we move, just like my fingers. And there's 3 joints in here. The joints should move and function optimally. Well, what can happen is my finger can still move and function like this, but it's not firing on all cylinders, not functioning properly. That can occur in our spine from things as early on as birth trauma, or obviously we just talked about sitting on a laptop or a cell phone and the postural stresses there. Accidents, falls, learning to walk or skateboard or roller skate, or get blasted playing football, or having kids can certainly create a variety of stresses. So again, how you sit in a car, how you sit and read or on a phone or watch TV, how you do anything can build up over the course of time if you have bad habits and bad tendencies. So again, sitting in general is very rough on your body. They say sitting is the new smoking. Even if you exercise regularly and you have a good diet, if you sit for more than 4 hours a day, you are 20% more likely to die prematurely than someone who does not. Very, very profound information and the detriments of sitting and having abnormal posture. This type of posture, again, if you do it for 10 seconds, not the end of the world. But if you do it repetitively for hours and hours and hours a day, it can lead to things like headaches, fatigue, irritability, stretched blood vessels and spinal nerves, disc degeneration. We talked about that. Again, muscle spasm. So we always ask, stop humping in public. Save this for someplace else, if you know what I'm saying. So this posture, again, this is happening in your generation at an exponentially rapid level. And it's something that can be controlled. And hopefully by listening to me for a few moments here, it'll be something you can start to be more mindful of yourself. So here's another representation again of that 42-pound head and someone looking down at a cell phone and how that stretches out that spine, flattens out the disc, and causes pressure and tension on the joints. So deviations in our center of gravity, having abnormal posture, lead to a plethora of symptoms from digestive or intestinal problems, hemorrhoids, varicose veins, poor health, and even a shortened lifespan. So you lose vital nerve flow, you lose lung capacity, and your body's not functioning optimally. You can actually die prematurely from having abnormal posture. So it doesn't matter how old you are. Again, this is a 22-year-old patient. This might be someone that's not even as old as some of you sitting in this class, but their curve is going in the wrong direction and their spine's breaking down prematurely. This is a 75-year-old patient who still has a good curve and still has good fluid content in his disc. So this is a huge difference in two people that are over 50 years apart in age. And I apologize, my son's crying. Trying to make it through here. Having a quiet time is a little tricky, but hopefully you get the picture here and can understand what's going on there. So here's an example of someone with a shift in their posture. And from a surgical standpoint, they may say, oh, he's got a herniated disc or bulging disc, or we're going to put rods in to straighten out their spine. What we look to do is actually change and bring that posture, if they're shifted this way, bring them back to neutral. If their head shifted forward, we look to bring the curve back into their spine. So we can actually change your structure, change your posture. You can also change your function and get proper motion and mechanics back in the joints in our spine. So this is an example of what we call corrective based care, where this person came in, they had a reverse curve in their neck. This person was 40 years old. So they were breaking down here. You're never going to get rid of that lost tread on the tire, so to speak. But this is us putting a curve, working with them, working with rehabilitative exercises, and bringing that head back over the shoulders and restoring that posture. And this person is going to have a much healthier spine going forward if they keep that there rather than being on the left side here. This is an example of what we look at from the ground up. And if you can see this person, they have a dramatic difference in their tone in here. You can see the quad is engaged here on their right leg, but it's not on the left leg. And oftentimes this can lead to things like medial knee injury, MCL injury, meniscus injury, work its way down into the ankle because of abnormal function here, up into the hip or the low back. So from a surgical standpoint, if you have an injury like that, you go in and fix the injury or replace the knee or whatever it may be. But what we do, and this is not my patient, but this is what we do on a regular basis, we balance out his foundation. He had a collapsing of the arches in his left foot versus his right, and that was causing a change in what's called the Q angle, how the femur and the tibia line up. But if we balance out the arches, you can see there's a dramatic difference in the engagement of the quadricep here, and this person's going to walk, let alone run, with much, much more balance and symmetry than this person. It's the same person. So musculoskeletal issues, disease, leading cause of disability, super slippery slope with the opioid epidemic. I personally have lost two of my dear friends, college roommates, from that. It's a huge problem. You don't have to look too far, too wide to either know of or have someone in your family who's been affected by this. It's a huge challenge. And when I do these talks, I never want to try and profess that I have all the answers, but we try to take a structural and a functional approach and enhance structure and function instead of this person taking Percocets or Oxycontin or whatever for his knee pain and from surgery and recovering from surgery, if you balance out their mechanics and you balance out their posture, they can have a tremendous enhanced quality of life and functionality and never need to resort to those things. So that's really a big portion of what we try to do and make people aware of. In our office, we do a lot of work again with posture, structure, function, and also working manually on muscle rehab and getting muscles to fire and function properly. So again, go back to the rubber band analogy, but also the curve. If you have tension in the muscles up and through here, so your trapezius, your levator scapulae, your rhomboids, we use a technique called active release technique. The ART is very popular with marathon runners and cyclists and Ironmen and all types of athletes because it works on breaking up restricted tissue and getting the tissue to glide and function and fire more effectively. So this is something fairly unique. Not a lot of offices do what we do regarding that, but we try to take a fully encompassing approach to looking at someone's feet up and then looking at their posture, looking at their hips, looking at their shoulders, looking at their soft tissue mobility and mobilization, and trying to enhance and restore more optimal muscle function. So this one's talks about the cumulative cycle of how injury can occur and how the restricted muscle fibers can build up. But basically it's called hypoxia, where you get a decreased oxygen in there and swelling and edema can build up. But this is, again, a huge challenge in musculoskeletal issues. And we look to try to prevent those or rehabilitate those if someone comes in with an injury, try and get them back on track instead of, again, going for the opioid route and potential slippery slope with that. So big problem. And what we do is not the solution, but I do feel very strongly that it is part of the solution. So I'm going to skip through a couple of these. They're a little bit more science than I think we need to get into here. But basically the whole concept of what we do in our office is to try and look at where someone may feel on a continuum. And if you look here, optimum health, optimum function on the very far right, what can happen over time? And I know I'm talking to a fairly young group of people here, but if you don't have good habits and good routines and stay proactive with your health over time, you can fall into this kind of, I feel okay, but over time you start to become less active and what we call the used to be's. I used to be able to run up the steps, no problem. And now I'm getting a little short of breath, or I have to go up one at a time and I can't go boom, 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 boom. I have to go one step and then meet, one step and then meet. Gradually over time, that continues to break down. And then you get to this area here where people can suffer from multiple medications, poor quality of life, and often needing infection medications in order to just get through the day. We try and take someone from here and bring them over as far as we possibly can by getting them to be able to eat better, move better, think better, and live a more active, healthy life. It's certainly a huge priority. Love this quote from the Dalai Lama, and talks about what surprised him most about humanity and how man spends most of his life working and doesn't pay attention to his health. And then as he ages, he's very concerned about his health and wants to spend the money and whatnot that he has trying to regain his health. Powerful quote and something to think about. I know, again, very young audience here, but something to think about going forward. So this video here, I think, is very powerful. And I want to close with this and how the different choices we make. We can't control everything, but this is something that we can have control over and how we choose to age and the choices that we make. Sorry. So while you might not be anywhere near the age of this person in this video, the choices that you make now and being more aware of your posture now, instead of waiting for your body to completely break down and then have a surgery or rehab or need PT, whatever the case may be. But if you can stay more aware, more proactive in your approach to taking care of your spine, taking care of your nervous system, that's what we really try to strive to make people aware. And certainly if somebody comes in and they have pain, they have limitations, we try to get them as well as possible without any medications, without any drugs, any surgeries, but to truly bring out the best in that individual. So that's a little bit about what we do as a chiropractic office, and we're located in the Roxborough section of Philly. And we've had several students from Dr. Garris's class and other people from Temple. I actually have had 2 gentlemen that have graduated from Temple, went on to chiropractic school, and then came back and interned in my office, did what's called a preceptorship or an internship. And the second one of those is currently waiting for his last part of national boards. And if all goes well, he will start working full-time in our office, being another doc in our office. So excited to have that, and love what we do with Temple and the Owls and the sports teams and whatnot. But if we can be a resource for you, if you have any questions, please feel free to reach out to me. Best way to get a hold of me would be via email. It's Dr. Lenny, DrLenny, at summitspineandwellness.com. Again, it's Dr. Lenny at summitspineandwellness.com. And I hope you got some information out of this. I hope you can start thinking more proactively about your posture and taking care of your spine and nervous system. And I hope you have a wonderful day. Thanks.